So yesterday we started talking about knowing your options and kind of, setting up your birth support team. So we established a little bit of a platform. Today I want to take the next step and talk about some of the things that you may encounter towards the end of your pregnancy, some things that start to come up, conversations you might have with your doctor about induction, about vaginal exams. I think it's really important that we kind of talk about this because I want you to know your options. I want you to know, that, what you have available to you. So let's start with as you get to the end of your pregnancy. And hey guys, so as you get towards the end of your pregnancy and you start to have more frequent doctor visits. So throughout your pregnancy, you may have gone once a month to see the doctor, and then now you're getting closer to the end. So your visits increase maybe every 2 weeks, and then closer to the end, like every week, right? And so I think what we've all kind of accepted as common practice is to have vaginal exams and checks towards the end of pregnancy, right? And it's just kind of become this standard thing that most doctors just protocol they do, right? Because most women, they want to know, like, how are things looking? How am I progressing? Am I dilating? Am I effaced? We're so curious and we want to know what's going on. So, and I see a request from Julie Valise, it looks like, to join. If we have time at the end, I'll grab you in and see what, if I can answer your questions. So I want to kind of, get through some of this stuff, and then if you're still here, I'll grab you. Okay, so towards the end of pregnancy, right? We start talking about vaginal exams and, what's the whole point of them? So a lot of doctors will offer to start checking your cervix at the end of your pregnancy. And it can be a little uncomfortable for moms because, things kind of poking around down there doesn't really feel so great at the end. And what's the purpose of it? So the purpose is that doctors are checking to see if you're dilating or to see if you've effaced. And so if you're not sure what those are, dilating is when your cervix opens from, you start at 0, it's completely shut, and then it'll open all the way to 10 centimeters dilated, right? And so what that visually will look like is like a bagel. So it's actually really big. And I know it was always hard for me to visualize, like, how is this baby going to get through there? I don't understand that. But when you start to understand that, you're dilating from 0 to 10, it makes a lot more sense because now your bagel size cervix opening can actually fit the baby, and that's what your body's designed to do. So when we talk about effacement, just a little, side note, we're talking about how soft your cervix is, or hard, right? So it starts out really hard, up, tight, and closed. What you want is for it to be soft and open, right? So effacement is softening. So if you take your finger, and this is kind of a strange reference point, but if you take your finger and just kind of feel the skin right here, right? So that's like harder because there's cartilage, right? But there's it's harder. And then if you just softly, sorry about that. If you softly touch your lip, you can feel the difference, right? So you can feel the difference in the softness between here and here. And so this is just kind of give you an idea of what I'm talking about when we say effacement and softening of the cervix. It actually softens it. So when your doctors are offering you a vaginal exam or a pelvic exam or a cervical check towards the end of your pregnancy, what they're looking for is how dilated you are and how effaced you are. They're also, looking for, kind of where the baby's at. So they'll give you an idea of that, right? The biggest misconception I think a lot of moms have is that this is absolutely a required thing and it's just kind of standard and you have to do it. But you don't have to have cervical exams at the end of your pregnancy. You can absolutely turn them down, right? Why would you want to turn them down? Why wouldn't you just do it? Well, because I feel like one is having a cervical exam and finding out your dilation and your effacement, is it really going to change anything? So if it's not going to change anything, then it may not be necessary. It might just be more of a mental screw. For me, that's how I felt for my third. I felt like knowing the number of how dilated I was or wasn't was just going to mess with me mentally. And it really doesn't tell you anything about how quickly or how long your labor is going to progress. I have met women who walk around at 3 centimeters dilated for a month before they give birth. And I've met women who are 0 centimeters dilated until they're in labor. Right? And then you can go from 0, 3 to 10 centimeters quickly. It really is, there's such a wide variation of normal, right? There's a huge range of normal here. This is birth. This is not a one size fits all, And so finding out how dilated and how effaced you are, it may be something that gets you overly excited because you're like, wow, look how dilated I am. I could have this baby right now, but maybe you won't, or you might feel discouraged. And a lot of moms feel like they get discouraged if they're not quite dilated as far as they would hope, or if they're not effaced yet, and maybe they're only 37 weeks. A lot can happen after 37 weeks. You're not even term yet. So it's kind of something that drives me crazy because I get that urgency. I understand how it feels. I am somebody who carries my babies for a long time. I feel like I'm growing freaking toddlers, And so at the end, you're like, oh my God, I just want this baby out of me, But, when you're 37 weeks pregnant, that's 9 months plus a week, right? You're not even fully term yet. You're not fully, your baby may not be ready. Okay. So the temptation is so real and you're like, okay, I'm ready. 37 weeks. I'm considered, early term. We're safe. Yes, you're safe, but that doesn't mean the baby's ready. You know what I mean? There's a difference. And so this will all kind of play into this whole conversation today, but I wanted to start by addressing the vaginal exams. And so they're not absolutely necessary. You don't have to do them if you don't want to. So my first pregnancy, I did them. My second pregnancy, I did them. My third, I wisened up and I learned more about myself. And this is such a personal decision, right? But if you are thinking along these terms, those numbers really don't make an impact. And I learned that they have no impact on my birth. So it really was doing nothing but mess with my mind. And what I call it is like a mind F. So it was just mind effing me because I didn't need to know the numbers. It wasn't going to change anything or affect anything. So I chose to decline vaginal exams all the way until my 41-week appointment. I still didn't let them do a cervical exam. I allowed an ultrasound to check and make sure the baby had enough fluid and that she was healthy, but I still knew that the vaginal exam wasn't going to do me any good. So I turned it down. Also, just kind of a side note, there are a lot of women who have experienced sexual trauma during their lives. And so unnecessary, really unnecessary additional poking and prodding around down there can be really an uncomfortable situation for women who have experienced things like that. And it can be traumatizing, and bring back old weird feelings and uncomfortable feelings and things that we don't really want to have to bring up. So, just know what I want you to take away from this point is that it's an option. You don't have to have a vaginal exam. If you want to, do it. But you don't have to. And so I just wanted you to have that information, right? Okay. So now that we've talked about that, I want to move on a little bit to inductions because this is something that's come up a lot lately. I've had some conversations privately with moms that we've, talking about, we have the, in our private calls, and we're talking a lot about induction and how far your provider will let you go. And this comes up a lot for VBAC moms, especially because providers vary widely with how comfortable they're letting you go during your pregnancy before they want to step in and induce, right? And so what I want to say here also about inductions is that it's always your choice, okay? It's always your choice. You don't have to be induced. You don't have to. Now, if there's a medical necessity, I would suggest using some common sense here. And if there's a medical concern, an induction may be something that would absolutely be beneficial to you. Even if it's not absolutely necessary, inductions can be really great for a lot of women. But I want you to know that you don't have to do anything. There is something called informed consent. And so you are not forced to do anything, right, that you don't want to do. So a little bit more about inductions. Let's talk about the reasons. So the two primary reasons that women would be induced, and just a little bit of background, induction is when your doctors, or whomever you're on your team are intervening in the natural birth, natural labor process and kind of kickstarting things, usually in an artificial way. I'm going to talk about natural induction options and medical, so more artificial induction options so that you know what the options are. But the two main reasons that people do it are medical reasons and for convenience. So medical reasons would be basically anything that would make it more dangerous for baby to be inside the womb than to be outside. So if the baby's not thriving or growing inside, or if mom has some kind of infection, preeclampsia, gestational diabetes that's, at a certain point where it's safer for baby to come out than to be in, that would be considered a medical reason for an induction, right? Convenience reasons are when there's not really a medical reason present, but maybe mom is just exhausted. Maybe she's tired, she's done with pregnancy, and she just wants this baby out. And I get it. I get the temptation. The temptation is so real. And if you've been there and you're towards the end of your pregnancy, give me like a high five or something and show me, drop me an emoji, because girl, the end is rough. My first went to 40 plus, 39 plus 6. So I was right at the end. My second went to 40 plus 3, and my third pregnancy went to 41 weeks. So I know how hard the end is. It is so hard, and every day feels like a year. And the temptation to be induced is so real. And there's reasons why it may not be the best option for you. For me, it wasn't the very best. Hey guys, high blood pressure. Yeah, that would be something, a medical reason that, Julie, it looks like, right? That could be something that would be a good reason for medical induction, definitely. So I get the temptation, but for a lot of moms, sometimes I don't think what people realize is that being induced, especially with the medical options, it really interferes with the natural and the physiological process of birth. And I can talk more about that. There's a lot more detail in my classes that are in the virtual library on my website. But basically, it interferes with this natural process. So what ends up happening is when you are induced, you have a greater chance at other interventions being necessary, a greater chance at things not necessarily going to plan, other interventions being needed, higher chances of cesarean rate, things like that. So it may or may not be the, the best option for you, right? Totally a personal person-to-person thing. All right, so more a little bit about the convenience reasons. So a lot of women say, well, I want this particular doctor and he's out of town on those dates. So if I want to make sure that I have my doctor, I want to be induced when I know he's there. That's a common convenience reason. Or military families that's a huge reason, because maybe dad, or somebody in the family is only going to be available for the birth for a certain window of time. Or other traveling jobs, or other jobs in general, other people that you want at birth. If you want your mom there, if you want your grandmother there, somebody, your person, and they have a limited availability, then that would be a convenience reason. So yeah, and I get it. I get the temptation. Just know, it's one of those things that you have to really weigh your options and think about what's going to make the most sense for you and for your birth, and to achieve, kind of overall what you want to feel and experience during your birth. Okay, so I do want to talk a little bit about ACOG. Before I do that, I'm going to read this. Hey, Jasmine, I know a doctor who induced because of his schedule. Yeah, you know what? That's a really common thing. I hear a lot of that doctors are suggesting inductions because of their own schedule. And I'm going to go ahead and go here because this is my Instagram, and I'm just going to, put my opinion out there. I do also tend to see a lot more inductions and women that report suggested inductions by their doctors right before holidays. And I was there. I was part of that, because when I was giving birth to my third baby 5 months ago, when I was 41 weeks pregnant, I went to my 41-week appointment. It was Friday before Labor Day weekend. And when the doctor walked in, she said, "Hi, Nicole, I'm Dr. So-and-so, and this is the first time I had met this doctor." If you know me, I was seeing midwives throughout my pregnancy, but I did occasionally see, the doctors that were on rotation, because you wanted to kind of meet everybody. So this is the first time I met her, this particular doctor. So she walks in, "Hi, I'm Dr. So-and-so, and I understand you're 41 weeks pregnant today." And I said, "Yes, ma'am." And she said, "And I understand you're trying to have a VBAC, and you are over 35 years old." And I said, "Yes, I'm going to have a VBAC, and I am 35 years old right now. I just turned 35. Thank you. So I understand I'm Geriatric Moms Club." And she said, "And you know that every day you go past 41 weeks, you are at a greater, increased risk of stillborn." And I said, "I understand the risk. I do. And you know that every day past this point that you go pregnant, you have a lesser chance at having a VBAC." And I said, "Yep, I understand that too." And she said, "Okay, so I'm going to go ahead and suggest that you walk across the street and to the hospital and start your induction." And I very kindly, and you don't have to be this is Instagram, you can curse. You don't have to be a bitch about it. But I very kindly said, "You know what? Thank you. I understand the risks, but I'm not going to be induced today." I had talked to another midwife, and I want to go to 41 plus 4, and then we'll start to talk. But it just wasn't something that I was interested in doing. So she was pretty confused. I'm going to scroll back so I don't miss this comment. Dandy Lou Who, sorry, my phone's jumpy. "My doctor said most of her patients get induced, and if I go into labor on a weekend, she won't be there to deliver my baby." Well, she might be in the wrong line of work, girl. Because if she's there to help, and first off, she doesn't deliver babies. You're delivering that baby, you're doing all the work. You're delivering the baby. She might catch the baby. but you're doing the work, like you're doing the thing. And she might be in the wrong line of work, right? So she's saying if that's her job and this is where her passion is and where her heart is, babies come on the weekend. They come on the holiday. They come when they're ready to come. And they know when to come. They know when they're ready. There are extreme circumstances where babies just don't, when they need a little push. I agree with that. I do. I'm not completely crazy, but that kind of pisses me off. And so if most of her patients get induced, why is that? I would ask, because does she not trust your body? Does she not trust the physiological process? And so there are situations I do believe that inductions are helpful. I'm not disagreeing with that. But to say that as a general blanket statement, that sounds kind of crummy, and what's your first name? Because Dandy Loohoo, I love it. It's so cute, but I want to know your first name. So rude. Jasmine, trying to scare you with info you already know. Yeah, exactly. I know. And that's kind of how I felt. And I feel like they do have to tell you certain things because some people don't know the risks. And some people may feel like, that's not a risk I'm comfortable taking. Now for me, I knew the risks and that was a risk I was comfortable taking. And boy, did I have to hold faith. I mean, it required me to really go inside and hold some faith in my body. I couldn't even stand up straight. I was walking crooked as hell all through her office. I had these shooting nerve pains running through my legs and I had my belt on, the Velcro wasn't even working anymore. It was hardly holding my stomach up. My husband's like, why are you even putting that thing on? It doesn't even stay on anymore. It lasted through 2 pregnancies. And I'm like, I don't know, because it's giving me some false sense of security. I don't know. And so I'm walking, she's like, you really don't want to be induced today? I'm like, no. So I did want to make sure that the baby was healthy and that she was okay. So I did do an ultrasound and we checked her fluids. Hey, Chastity. We checked her fluids to make sure she was healthy. And she was. She had plenty of fluid. She was thriving. She was moving. So I'm like, you know what? She's okay. Now, the thought of going into a 4-day weekend, holiday weekend and being pregnant the whole weekend and having 2 young children at home, I was crying at the thought of that. But I also knew I really went inside and just I had to hold my faith. I had to. Okay. Swanky mommy. My first was 9 days late. They kept pushing induction, but I refused. Just had to do stress tests. Yeah. Baby came on his own. See, and you know what? And the thing about 9 days late is and this is something I considered throwing into, my notes to cover today, but I ended up leaving it out was, they're not always perfectly accurate when they're calculating our estimated due date. So your due date isn't always an exact science. So most babies, in fact, 80% of babies are born between that 38 and 42 week window. So at 40 weeks, a lot of babies just aren't ready yet. I met a mom who had 5 kids that all came at 42 weeks. That's just how her body grows her babies. Her body needs 42 weeks, or her cycle may have been a little bit weird in the beginning. Our cycles, I don't understand our cycles. You know what I'm saying? That's not my jam. But I know that they can get a little screwy, And so to calculate the exact due date, so 9 days, that's totally within reason. And girl, good for you for, standing your ground and letting baby come on his own because they know what they're doing. They know when to come. Okay, some of this. My hospital has a policy to induce at 41 weeks. Is there a way that I can wait until 41 plus 4? Absolutely, because it's not, okay, they have a policy. That doesn't mean that it's law, right? So there's a difference. So hospital policy is totally normal. Every hospital has policies, but that doesn't mean that you have to do something. This is your choice. This is your pregnancy. This is your birth. Right? And so unless there's a real problem, a medical reason that you're you know what, maybe I should. But if you're listen to your intuition, look at your pregnancy as a whole and have these deep discussions with your provider and say, look, this is just something that isn't sitting well with me. Just because the policy is 41 weeks, I'd like to explore and discuss what it would look like for me to go 4 more days. And you can really be firm in a nice way about it. Again, you don't have to be a bitch about it unless you want to. You can do that too. But there's nice ways to say and stand your ground firmly, because this is the first time in your life for a lot of us as women that we have to be our own advocates. Because, now I'm going to go off on a feminist tangent, but for so long, women are really taught to kind of be, suppressed, and to suppress our opinions and to kind of hold that stuff in and be quiet, seen, not heard, and not talk back and not push back. And so we're taught for so long to not speak up for ourselves. And so motherhood, what I find is that this is the first time in a lot of our lives for a long time since we were children, where a lot of women realize No, I need to step up and say something. Like, I need to advocate for myself. I need to advocate for my baby, because if I don't, who will? You know, like if I don't step up and make these, say these things, then nobody else will, for me or for my baby. So yeah, that's just a little bit of a feminist tangent. I'm not done about the feminism, because I could get going on that too. Marissa, hey. I will decline getting induced unless it's medically necessary. My body knows what it's doing and was literally made to deliver this baby. Baby will come when he's ready. You're right. You're right. And I totally support that, you know, and I know for some women being induced is so tempting when you're in so much pain and you're so tired and you haven't slept and you just want that baby out. Here's what I kept telling myself, the pep talk I kept giving myself at the end. I always remind myself those last, like around week 37 is when shit starts to get real. When everything just really starts to slow down and you're like, okay, it's all been cute until right now, you know, and that's when everything gets real. And so the pep talk I keep telling myself is like, baby's not ready. The longer the baby cooks, the more mature their body is, the more mature their organs are, the better they'll be able to eat. And in my head, I associate, okay, the better they can eat, the more little full their little bellies can get, even if it's just a little tiny extra drop, that might get me an extra couple minutes of sleep in each stretch. So I try to kind of go, you know, look at it that way in a cute, but, you know, pep talk kind of way. And then I think about, you know, if the baby's not ready, what kind of complications am I going to cause by trying to push the baby out when they're not ready yet? You know, like what am I stirring up? What kind of shit am I stirring up by doing that? So I try to give the baby time. And, you know, I do firmly believe that having faith and holding faith is just, gosh, it's hard at the end. And even for me, even for a doula who has done it 3 times, that 3rd time, even still, man, starting at week 37, 38, those last 3-4 weeks are rough. Okay, did I miss anybody? Vero, thanks for the info. Sometimes you go in thinking doctors know it all, so you'll do whatever they say. It's empowering to know that unless medically necessary, we can let our bodies take their time. Yep, and do what they're created to do. Exactly. Totally agree. Hi, you guys. Also, I'm so happy I found your group on Facebook. It's my first baby, and I'm so glad that I have this info and to know my options for birth. Yay. How far along are you, Marissa? Dandy Lou who? My daughter, this is like a little funny side note that I have to throw in here real quick before we keep going. Cindy Lou who, right? So my daughter's hair, at the end of the day when I take it out, I don't know if you've seen her on my IG stories, but she has super curly, like amazing, beautiful hair. But when I take her hair ties out at the end of the night, it like stays straight up like Cindy Lou Who. So I'm like, oh, my little Cindy Lou Who. So she thinks she's Cindy Lou Who, and it's the cutest. It's the cutest. Oh, you're 28 weeks tomorrow. Yay. All right. So let's talk a little bit about what ACOG says about induction. So if you don't know about ACOG is the American Academy, blanking on the C word, coalition of obstetricians and gynecologists, right? So they are like the body for, you know, prenatal care, birth, all the things, right, in America. ACOG does not recommend inductions prior to 41 weeks pregnant unless there's a medical reason. And we've already kind of talked about this, but why do they say that? Because the baby's still developing, right? So even after 37 weeks, baby's considered safe, but there's a lot of development that happens between 37 weeks and 41. There's still a ton going on in those 3-4 weeks. So if the baby's not ready and not fully developed, it might not be ready, right? And your body might not be ready for birth, right? So a lot happens in your body those last couple weeks too. And then in a normal and otherwise healthy pregnancy, introducing induction options can really increase the risk and, you know, of your birth and increase the chance of other interventions. And so, yeah, I just really want to hit home that unless there's a medical problem, and so in the absence of any other medical issues, you don't have to be induced. You don't have to. You're right. Some of this. My pregnancy has been really good. No complications. Baby and I are healthy. Am I exhausted? Yes, girl. But I know that she'll come out when she wants. Thanks for the boost. It's true. It's true of confidence. Yeah. And you know, the other kind of joke I always told myself was like, the longer they stay in, the quieter they are. It's quieter. It's quieter. They will never be as quiet as they are when they're in the womb. Never. And even when they first come out and they cry and that cute little newborn cry, you know, even that, like, that's the sweetest little cry. But the older they get, the less cute their cries get. And the way they chew. And like when they first come out, the sound of their eating is so tender. And it is the sweetest thing. It makes me melt like crazy. Even my toddler, I notice, I'm like, she still sounds really cute when she eats. And I'm somebody that has a problem with the way people sound when they eat. I hate people chewing in my face. My 5-year-old, he has reached that point where I'm like, okay, I think at 5 years old, that's about the time that it's not so cute anymore. Because now I catch myself, I'm like, dude, close your mouth when you're chewing. It's driving me apeshit. So, you know, just like a side note, but it's true. And it's so cute when they come out and you're like, oh my God, listen to the sound they make when they suck on my boob. You know, it's so cute. It hurts like freaking hell, but it's so cute. Okay, so a little bit more about induction. So if you are considering an induction and you think that it's something that may benefit you, if you're like 41 weeks, 41 plus 4, if you have a medical reason, something that your doctor may propose and that you might, may be an option to you is to check out what your Bishop score is. And so what that is an induction calculation that your doctor does for you to tell you how favorable an induction might be for your birth. Right? So like how realistic, there's a scale. And so how favorable are things looking if we were to try to induce? So what they'll do is a cervical exam and they'll check your effacement. So they'll check, which is expressed in a percentage. So you start out at 0% effaced, right? And then you soften up, like I pointed to, you know, the nose versus the lip earlier. So you're starting out, you know, 0%, and ultimately what you want to be is 100%. So they're checking your effacement. They're checking your dilation, see if you're at 0 or if you've opened up to the bagel to the 10 centimeters. And they're checking the position of your cervix because the cervix does move as well. And then they're checking the fetal position. So they're checking where the baby is, what station. So your pelvis, right? So the baby comes down and starts engaging. So they're checking with the station. So where the baby is, at the time that they do the assessment. So depending on what your Bishop score is, you might have a number, it's just a calculation that shows how favorable an induction might be. So if that's something that you're considering, just know that that could be a tool that's available to you to give you an idea of what things might look like. There are no guarantees. This is birth, right? So anything could happen, but this is just an option. All right, and so a question that I get asked all the time is, okay, I'm 37 weeks, I'm 38 weeks, I'm 39, I'm 40 weeks. I want to get this baby out. Like, what can I do to get this party started? All right. So what I'll say first, there are some natural things you can do to try to kickstart things. Are all of these things or any of these things going to put someone into labor if their body's not ready and their baby's not ready? No. I don't think so. I don't think that if your baby, trust me, I've tried them all. So, when I was about 39 weeks pregnant with this last one, I started doing all the things. And if you followed me on Instagram back then, it's still available, I think, in my highlights, but I was bouncing literally one day, I was bouncing on my yoga ball, massaging clary sage oil into my, like a fundal massage to the top of my cervix top of my uterus to try to stimulate contractions. And I had my breast pump on. I was like doing all this stuff, sitting here doing, and my husband walked in. He's like, what the hell are you doing? I'm like, dude, just give me a minute because this is happening. Like, I'm going to make this happen, but it didn't happen. So you can try all of these natural things. But what I always tell women is if the baby's not ready, she's just not ready, or he's just not ready. But if your body's like right there, sometimes some of these things can really help to give you that extra push. So let's talk about what some of these natural things are. So natural induction options. These are things that you can do. All right. 1, sex. So the same thing that you did to put that baby in there is what can help get that baby out of there. Now, I know it's kind of a joke, right? Because at the end, for a lot of women, it's super uncomfortable and it's just physically almost a joke. But sex is really great at helping the baby. If your body's like right on the edge, it's good for a lot of reasons, right? Because one, the love hormone, oxytocin, is what stimulates your uterus to contract. So when you're having intercourse and you're being intimate, your body's producing oxytocin. So that's one thing, right? Another reason, there's the obvious of it helping things to stretch a little down there, but then also semen. So semen inside of you is really good to help your cervix ripen. And so I'll explain later, there's a drug that's an artificial cervix ripener. Semen, they say like 3 times the amount, 3 times of semen inside your body has the equivalent effect of using the artificial drug. in the prostaglandins, right? So things that will soften your cervix. So side note. Okay, so sex. Little thing about sex, if your water has broken, I don't recommend having sex because you could introduce infection. We don't want that. So if your water broke, that's enough sex for now, right? All right, the next one, nipple stimulation. So when I say nipple stimulation, I feel like what people see, or what the first time I heard it, I thought people are sitting there like twisting their nipples. And that just sounds painful, especially during pregnancy when your nipples are so incredibly tender. The last thing you really want to do is sit there like twisting nipples. It's not that. Think more of like massaging your entire breast. Actually put the pump on. The ideal situation, if you want nipple stimulation to try to encourage labor, is to put the pump on. So why is that? Think about when the baby's breastfeeding, when the baby's at your breast and breastfeeding, your body's stimulating oxytocin, again, that love hormone, to help your uterus contract, is part of why, to help your uterus contract back to its original size. So if you want that oxytocin, putting the breast pump on is something that can stimulate oxytocin, which could cause, your uterus to contract. So that's why we suggest nipple stimulation. Another thing, acupressure points. So there's pressure points all over your body, right? There are specific ones that can really help to either jumpstart labor, or if labor has appeared to stall out a little bit, there are certain acupressure points that can help labor to progress. So if you want that link, I have it on my website. It's under one of the classes, there's like a resource list. So, and I can send it to you too. I don't know how to post it here. Can't think of how to do that. But yeah, so there are acupressure points that you can try. And so you hear people like, oh, don't get a pedicure at the end of pregnancy because it could put you into labor. It's kind of one of the reasons, because they're massaging and they could hit, there's a pressure point kind of by your calf that can really help labor to get going, right? So acupressure, natural, can't really hurt anything if you're already at that safe zone. Acupuncture and moxibustion. So this is a, Eastern medicine thing. And if you're into that, which I've tried it before, I tried it with my second pregnancy. I have heard women that like swear by it. They go in for acupuncture and moxie, where they like light this, kind of looks like an incense down by your foot. A lot of women swear by it for turning a breech baby, but also for going into labor. So if that's something that is of interest to you, you can definitely, try to find somebody in your local area that specializes in acupuncture for pregnant moms and to go into labor. Another option, aromatherapy and essential oils. So there are essential oils that are known to really help. So I mentioned clary sage is one, and I actually massaged it like a fundal massage into the top of my uterus area. So that's an example. You might run some aromatherapy essential oils in your diffuser. I'm pointing that direction because that's where mine is. Or put them on a cotton ball and just kind of sniff them. Those are some options too. Walking, and so exercise, squatting. Now you want to be careful not to overdo it, right? You don't want to exhaust yourself right before giving birth. Not a great idea. With my first, I was 39 weeks plus 6 days when I went into labor, but a few days before that, I was so done with being pregnant. I walked 3.5 miles in my neighborhood. I came back home and did 150 squats, and then nothing happened. And I was like, what the hell? I just did all of that. My body is so tired. Now I don't want to go into labor. I'm trying to hold this baby in because I need my rest. I need to sleep before the no sleep period starts, So exercise, yes, but not to the point that you're going to push yourself. Walking, curb walking is really helpful. It's helpful for baby's position, but also to kind of encourage things get moving. Curb walking is when you're like outside, you have one foot up on the curb and one foot on the street, and you're kind of staggered walking. I did a lot of that with my third pregnancy. If you can do squats, squat. And I don't necessarily mean up, down, up, down, up, down, but rather get down into a deep squat and just try to hold it and rock into it a little bit, and be careful with your knees. Don't hurt yourself. If you need to do a supported squat, try that. And of course, this is all assuming you've been cleared for physical activity, right? And that there's no reason why, if you have no reason why, that you shouldn't be doing it. Sorry, I paused for a second. So supported squat might mean that you are holding on to something, like maybe your partner has one of those rebozo scarves and you're holding on to it, or a towel or something that you're like holding on to while you're squatting. So, and keep your feet pointed straight ahead. So don't angle your feet out. Keep your feet pointed straight ahead. And I got that tip off of a Birthful podcast episode quite a while back, and it always stuck with me. So during pregnancy, I stopped doing sumo squats. So like legs, feet pointed out, and tried to keep them pointing forward. It's all about alignment, right? Okay, so exercise, but not to the point that you're like beating yourself up and exhausting yourself. Your yoga ball. If you don't have one, get one. Every pregnant person should have access to a yoga ball, a birth ball, exercise ball, whatever you want to call it. Bounce on your yoga ball, rotate your hips, do all the things to really keep things moving and loosening up. That's what you want, right? And then these are kind of old wives' tales, but again, they can't hurt. But like certain foods, so they say pineapple, they say spicy foods. There's actually an eggplant parmesan recipe. And again, if you've been following me on Instagram for a while, you would have seen I made that recipe that's like the famous eggplant parm. I think I made it when I was 40 weeks pregnant, 39 plus change. And I firmly believe that it's not so much about the damn eggplant as about the process of cooking it. Cooking eggplant parmesan, being on your feet and going through all of that is what's going to put you into labor. Because when I was done with it, I was like, I need to sleep like an entire week. I'm so tired from making this damn, homemade eggplant parm. And it didn't put me into labor. Some women swear by it, but again, it's one of those things. It didn't hurt. I mean, it's actually pretty delicious. But yeah, so that's just like another option. But now I want to get into a little bit about the medical induction options, because I know that's what a lot of people want to know about. And we start talking about medical induction options are anything that your doctor or your provider, your midwife would do that's considered a medical intervention. So a medical intervention to start your birth, to start labor, right? All right, so the first one, if you've heard of this, chime in a little bit. It's called stripping your membranes. And so this is when your doctor actually uses their fingers. Usually they have a glove on. I would hope they do. And they will go in and actually like swipe away the outer, the membranes. And a lot of women say that this is super uncomfortable and they're not really, it's not a very comfortable feeling. It can be pretty actually painful for a lot of moms. If you've had it done, let us know what your experience was. So stripping the membranes, does it always result in birth and labor right away? Not always. It doesn't always work. So again, if baby's not ready and things just aren't ready, they're just not ready. But a lot of moms like the feeling of like taking some control. So there are a lot of moms who actually really want to try that. Yeah, you're right, Jasmine. Some do it without telling the mom. You're exactly, yep, they do, because they'll say something like, I'm just going to go in and, do a cervical check. And while they're in there, they swipe your membranes or they break your water, which is the next thing I wanted to talk about, is rupturing the waters artificially. So rather than letting your water just break on its own, we're talking about when a provider, the formal way they do it is they take this hook, and it kind of looks like, my grandma used to crochet, right? So she had this old school like crochet hook. It looks a lot like a crochet hook. It's obviously a lot cleaner and more sanitary, but they actually take a crochet hook looking thing, it's a little device, and go in and break your bag of waters. So they're forcing your water to break. My doctor suggested that and said she said it didn't hurt at all. I would ask other moms who have experienced it, because a lot of moms probably would disagree with that. And they say that it can really hurt. I mean, for some people, no, maybe not. Everybody's so different. There's such a variation. Same thing with contractions. I've had moms who tell me that they are in full on labor and they didn't even feel the contractions. They did not know. They just thought they were having some discomfort. And where I've experienced very intense contractions that are very clear to me that they are contractions. So it's so hard to say how people will feel. You know what I mean? Think about it like this, like tattoos, right? So people are all over the place with how they feel when they get a tattoo. Some people don't think it hurt at all. Some people actually like the feeling of tattoo pain, which I don't understand, but I know it's out there. And then some people, it really freaking hurts, so they just don't like it, right? They do it because they just want to do it. So it's kind of that concept of everybody perceives and feels and experiences pain differently. Our bodies are also different. Okay, so rupturing the waters. That's what, that is when they're actually using a tool to go in and break your water. Now, a common issue with rupturing your waters is, again, if the baby's not ready, you're putting pressure on him, undue stress on your baby when they're not ready, right? So it may or may not be the greatest thing for you. Try to go with your gut and listen to what your gut and your instincts are telling you as a mom. If you're like, you know what, I really think that we're here, this is something I need to do it. But if you're kind of questioning it, you're like, I don't know, listen to that. And nobody should really be forcing you into a position where you feel like you have to do this, right? Another issue with breaking your water, artificially rupturing your waters, is when your baby has more fluid in your amniotic sac. So think about your uterus, and if they have more fluid, it's easier for them to move around and to get into better position. So if the baby's not in the optimal position for birth, once that fluid starts to drain out, it's a lot more difficult for the baby to move and to get into better position because they don't have the cushion of the fluid to move around in. So that could cause an issue in your birth, in your labor, if the baby can't get in the best position. You want baby to be able to get in a great position. So just something I wanted to throw in there too. All right, so another induction option that a lot of people have heard of, and I referenced a little while ago, are prostaglandin gels. So the common drug that we hear about a lot is Cervidil. This is actually a suppository, so it kind of looks like a tamponish, and it has a drug inside with a string, and so you insert it up into your cervix. It's commonly done like late at night, and then you sleep in it, and by the next morning a lot of women tend to experience some cervical ripening or effacing. So the reason that people use prostaglandin is to soften the cervix. So the next induction option that I want to mention, medical, is a Foley bulb. Okay, so this a Foley bulb, envision, it's like a little balloon. So they take this little balloon apparatus deal and put it up inside your cervix, right? So if your cervix has only opened a little or may not be open at all, they're inserting this balloon and filling it with fluid so that it applies pressure to your cervix to open. So the Foley bulb is helping your cervix and applying pressure to it to open, right? So prostaglandin gels helping it efface, Foley bulb helps it open, okay? And then the last super common, probably most common medical induction option is Pitocin. And that's what most of us have heard of Pitocin. So what is Pitocin? All right, I've talked a lot about oxytocin, which is the natural hormone that your body releases to stimulate contractions of your uterus, right? Pitocin is artificial oxytocin. So when you get Pitocin, when you get put on Pitocin, it's forcing your body to start having contractions that aren't natural because it is a drug that's being introduced into your body. It does interfere with the physiological process of birth. What does that mean? So when you get started on Pitocin, you will be confined to the bed. You'll be put on an IV and getting IV fluids. So you need to just know that that's kind of all what goes into being induced by Pitocin. A lot of moms feel like the contractions with Pitocin are more painful because they're artificial contractions. And so why they feel more painful is because if you have not introduced Pitocin, so if you haven't had anything yet, and your body is naturally releasing oxytocin to stimulate its own contractions, your body is also naturally releasing endorphins that help with the pain. So your body has like a built-in pain management system. So if you're not introducing things and kind of interfering with the natural process, your body will naturally give you some pain management. So those natural contractions, most women feel like they're not as uncomfortable, and they're actually quite manageable because of the endorphins. So when you introduce Pitocin, which is an artificial substance, it's creating these artificial contractions that can be far more painful, right? And also because now your body will not release oxytocin. It stops the release of oxytocin. It stops the release of endorphins. So now you don't have that natural pain management system in place. So what a lot of moms find is that when they get started on Pitocin, the contractions become pretty uncomfortable and sometimes downright unbearable, and they want an epidural. So now what you have is, Pitocin to stimulate contractions and then epidural to help you with the pain. But what an epidural can do is slow your labor down, right? Because it's a drug. It's pain management med. It's super effective and it feels really amazing. I've had two of them. But it can slow things down. So then what you'll find is a lot of moms, nurses will say like, okay, you got the epidural, it slowed things down, let's give her more Pitocin. So they'll put more Pitocin in, right? And then the same thing, it's that like cascade of interventions, what they call it. It's kind of a snowball effect. So it doesn't happen to everybody that way. Absolutely not. I mean, I have talked to moms who have had Pitocin inductions from the beginning. They started on Pitocin and they were fine, or they didn't need an epidural, or they didn't want an epidural. I've talked to moms who started on Pitocin and wanted an epidural, so they got an epidural. Like, no judgment zone, to each his own. But these are just things I want you to be aware of as you're making decisions that suit you and your family and your pregnancy and your birth, right? Also, something else to consider, we've talked about it on other lives, but I want to throw this in here because it applies for today, is, when you are, as you're going through the induction process, and you're interfering with the normal physiological process, you can kind of, most women, I feel like, go the faster, most doctors suggest the faster induction route. And I've talked about that with Katie here before, if you remember Katie, as far as jumping straight to Pitocin. But a lot of what you can ask for or consider is a slower induction that might take a few days, right? But you might start with something like a Foley bulb, or you might start with something like Cervidil, to start with getting your cervix ready before you're applying pressure to contractions. So something like a Foley bulb to start opening your cervix, maybe some Cervidil to start to soften your cervix, then getting to the point where you're like, okay, things are starting to open up, things are starting to soften. Now maybe we start with Pitocin to start contractions. Because if you jump straight to Pitocin, think about what you're doing is putting these artificial contractions against a hard, closed cervix. That's not very helpful, right? It's not always. So again, variations of normal, but it's just something that, to keep in mind, that you may have an option like, okay, maybe I'll do a slower induction, or I'll try this. I'll go home, I'll use Cervidil, I'll give it a try and kind of see what happens, right? Okay, so I think I missed some comments, so I want to go back a little bit and make sure I didn't miss any. Marissa, do you have a Dandy Lou Who? Do you have any info on evening primrose oil? I've heard that it helps with ripening the cervix. I do. And I didn't include it in this discussion only because there's some, I'll have to refer you to a really well-written article. So there's a lady that she's a nurse, and she may be a doctor, but she has a website called Evidence-Based Birth. So if you search Evidence-Based Birth Evening Primrose Oil, she has a fantastic article with all of the evidence. She is like the most thorough with her research on evening primrose oil. So I would recommend going there to read that article if you're interested. I've used it. I used it with my second. You can insert it vaginally towards the end of pregnancy to help soften the cervix. Some people take it orally or both. So totally up to you, but I would check out her article to see what the risks and benefits are, to see if it's something that you're comfortable with. Alyssa, List 93, I had the Foley bulb. Super painful to have it put in. More painful than membrane sweep. Oh, really? So you had both. You had both the Foley, and I have heard that about the Foley bulb too. Hey, Jasmine. Some people report that the epidural didn't work for them, so that's a possibility. Yes. In fact, there was a mom that just gave birth that I've been working with privately, and her first epidural didn't work. She didn't get a working epidural until like the very end when she was about to push. And so totally an option that sometimes the epidural doesn't work. Yeah, definitely. And I don't mean to step back. I'm not totally anti-induction. I'm not, because inductions are absolutely necessary and life-saving for a lot of people and a lot of babies. What I'm against is people feeling like they have to be induced just for protocol and not taking, having that chance and that choice to be their own advocate and decide what works for you. It is your choice. This is your baby, your birth, your life, and your experience. And so, take the information that's presented to you and give yourself a chance to process it and decide what you're comfortable with is what I recommend. So, and for a lot of moms, this comes up a lot for VBAC moms too. And I know we have some VBAC moms that are watching because we've talked privately. The induction conversation gets a little different when you're preparing for a vaginal birth after a cesarean, so it does get a little bit more complicated. But even still, you have options. You absolutely have options, right? And so I would not only suggest and urge you to really dive deep and explore those options with your provider, but also, talk to other moms like in my private Facebook group if you're part of that, or reach out to me and we can talk more about it. So yeah, I'm not against inductions. I'm not. I think that they're really helpful for a lot of women. And sometimes, let's say you have a mom that's been in labor for hours and hours and hours, and things are just not, they're not necessarily slowed down, but they're just taking quite a while, and things are really appearing to have stalled out. Sometimes just a little Pitocin, or even just a little bit of epidural to calm her down and give her a chance to take a nap. If a mom gets a little epidural and gets a chance to rest, sometimes that's all she needs to wake back up okay, I feel amazing. I had some rest. I'm ready to do this. She pushes the baby out. No complications, no problems. So, there are variations of what can happen. It's one of those things that it just really depends on what's going on with you and your birth. And same thing with Pitocin. If you've been in labor for hours and hours and hours and you are really exhausted and you just want to get moving, some moms are like, you know what, let me try a little bit of Pitocin and see what happens and give myself a little push, right? So, again, it's one of those things that it's so personal and it varies woman to woman, but I would suggest you go inward and really think about, what feels right to you? What is your intuition telling you? Okay, so the next thing I want to talk about